If you're over 50 and starting to notice changes in your erections, you're not alone. Many men silently struggle with this, feeling embarrassed or even broken. But here's the truth.
Erectile dysfunction is not just a part of getting old. It's your body's way of telling you something important. And the good news, in most cases, it's fixable once you understand the cause. I'm a urologist, and in this video, I'll gently walk you through the 5 most common reasons this happens and what you can do about it. As men age, one of the most natural changes in the body is a gradual drop in testosterone levels. Testosterone is a key male hormone responsible not only for building muscle and maintaining energy, but also for supporting a healthy sex drive and strong erections. When testosterone levels decline, it can significantly affect a man's sexual function, often leading to erectile dysfunction (ED). After the age of 50, it's quite common for testosterone to dip below the optimal range. This condition is sometimes called low T or andropause, and it's similar to menopause in women. The symptoms may not appear suddenly, but rather build slowly over time. You might feel more tired than usual, less interested in sex, and even notice mood changes or trouble concentrating. Most importantly, many men with low testosterone struggle to achieve or maintain firm erections. Now, let's be clear, low testosterone doesn't always cause erectile dysfunction directly. Erections are a result of many systems in the body working together: blood flow, nerves, hormones, and the brain. But testosterone plays an important background role. It acts as a kind of ignition switch for sexual desire and response. Without enough of it, the brain may not send the right signals to trigger an erection. Testing for low testosterone is simple. A doctor, especially a urologist, can run a basic blood test usually early in the morning when levels are highest to check your hormone levels. If your testosterone is low, your doctor might recommend lifestyle changes first. This can include losing weight, sleeping better, reducing alcohol, and exercising more, all of which can naturally raise testosterone. In some cases, testosterone replacement therapy (TRT) may be considered. This can come in many forms: gels, injections, or patches, but it's not right for everyone. TRT has benefits, but it also comes with risks, especially if you have certain medical conditions like prostate issues or heart disease. That's why it's very important to speak with a qualified doctor who can help you decide if it's the right choice for your health. One important thing to remember: low testosterone is not a personal failure or something to be ashamed of. It's a normal part of aging, and it's treatable. Many men feel relieved just knowing there's a reason they don't feel like themselves anymore. So if you've been noticing low energy, low sex drive, or trouble with erections, it may be time to have a conversation with your doctor. You deserve to feel good in your body, and taking the first step can make all the difference. One of the most common and often overlooked causes of erectile dysfunction (ED) after age 50 is poor blood circulation. Simply put, an erection depends on healthy blood flow. When a man becomes sexually aroused, the brain sends signals to increase blood flow to the penis. This fills the spongy tissues inside, making the penis firm. But if the blood vessels are narrowed, stiffened, or blocked, that flow gets interrupted, and so does the erection. As we get older, our blood vessels naturally lose some of their flexibility. This is especially true if a person has conditions like high blood pressure, high cholesterol, or atherosclerosis, hardening of the arteries. These conditions make it harder for blood to move freely through the body, and the penis is one of the first places to feel the effects because it relies on a delicate, fast-acting system of circulation. What's even more interesting and important is that erectile dysfunction can be an early warning sign of bigger cardiovascular problems. In fact, ED often shows up years before a heart attack or stroke. That's because the blood vessels in the penis are smaller than those in the heart. So, if they start to get blocked, you might notice erection problems before you ever feel chest pain. There are also lifestyle habits that worsen blood flow over time. These include smoking, being inactive, eating a poor diet, or carrying extra weight. Smoking, in particular, damages the lining of the blood vessels and reduces blood supply throughout the body. Over time, this can severely impair sexual function. The good news: blood flow can improve, often dramatically, with the right changes. Regular physical activity, especially walking, cycling, or swimming, strengthens the heart and improves circulation. Eating healthy foods like fruits, vegetables, whole grains, and healthy fats helps reduce cholesterol and blood pressure. Even small changes like reducing salt and sugar can have a noticeable effect over time. Doctors may also recommend medications to help improve circulation or manage underlying health problems. In some cases, ED medications like sildenafil Viagra or tadalafil Cialis can help by increasing blood flow directly to the penis. But remember, these medicines work best when the overall circulation is in decent shape and they don't solve the root cause. If you're over 50 and struggling with erections, checking your heart health is essential. Simple tests like a blood pressure check, cholesterol panel, or even an ultrasound of the blood vessels can provide valuable clues. Think of ED as your body's check engine light, not a sign of failure, but a signal to look deeper and take action early. By protecting your circulation, you're not just supporting your sexual health, you're supporting your brain, heart, and overall well-being. It's never too late to make changes, and every small step counts. Another major reason why erectile dysfunction ED becomes more common after the age of 50 is nerve damage, especially damage caused by diabetes or pelvic surgeries. Many people don't realize how important nerves are for sexual function. Without healthy nerve signals, even if blood flow and hormone levels are fine, an erection can still be difficult or impossible to achieve. Let's start with diabetes. This condition is known for damaging the small nerves and blood vessels throughout the body over time, especially when blood sugar levels are not well controlled. Medical term for this is diabetic neuropathy. It affects many parts of the body: the feet, hands, digestive system, and yes, the penis as well. When the nerves that carry signals from the brain to the penis are damaged, the body may not respond to sexual arousal in the usual way. You may not feel as sensitive, and it may be harder to get or keep an erection, even if the desire is still there. This can be very frustrating, but it's not your fault. It's a physical issue that deserves understanding and proper care. Another source of nerve damage comes from pelvic surgeries, which are more common in men over 50. For example, surgery for prostate cancer, called a prostatectomy, often affects the nerves around the prostate and bladder. These nerves are very close to the structures that help create an erection, and even when surgeons try to preserve them, some damage is often unavoidable. Other surgeries, such as for bladder cancer or colon disease, can also disrupt nerve pathways in the pelvic region. In some cases, the damage is temporary and improves with time, but in others it may be more lasting. Now, while nerve damage sounds serious and it can be, there are still treatment options. If you have diabetes, keeping your blood sugar well controlled is one of the most important steps to protect your nerves and slow down further damage. If the issue is related to surgery, your doctor might suggest medications, vacuum devices, or even penile injections or implants, depending on the severity of the ED and your overall health. It's also helpful to understand that nerve healing takes time, often months or even years, and progress can be slow. That's why patience, support, and ongoing care from a urologist are key. Emotional support is just as important. ED caused by nerve damage is not a reflection of masculinity or strength. It's a health issue like any other, and it can be managed with the right help. If you're over 50 and have had surgery or are living with diabetes, know that you're not alone and there are options. Talk to your doctor, ask questions. The goal is not just sexual health, but full body wellness, confidence, and quality of life. Many men over 50 are surprised to learn that some of the most common medications they take every day may be contributing to their erectile dysfunction (ED). These drugs are often essential for managing chronic health conditions like high blood pressure, depression, anxiety, or prostate issues, but they can also interfere with sexual function. Let's take a closer look. One of the biggest culprits is blood pressure medication. While these drugs help protect your heart and blood vessels, some of them, especially beta blockers and diuretics, water pills, can reduce blood flow to the penis or blunt the nerve signals needed for an erection. You may still feel sexual desire, but your body may not respond as it once did. Another common group of medications that may lead to ED includes antidepressants, particularly S-SRI selective serotonin and reuptake inhibitors. These are often prescribed for depression or anxiety, both of which are more common later in life. While these medications are helpful for mood and emotional health, they may reduce sexual interest or interfere with the body's ability to maintain an erection. Medications for prostate enlargement, such as finasteride, can also affect sexual function in some men. These are often used to treat benign prostatic hyperplasia (BPH), a condition that becomes more common after age 50. While they can't improve urinary symptoms, they may reduce libido or cause erectile difficulties in some individuals. It's important to understand that this doesn't mean you should stop taking these medications, especially without talking to your doctor. Many of them are necessary for your overall health, especially if you're managing heart disease, diabetes, or mental health conditions. The key is to recognize the connection and speak openly with your healthcare provider. In many cases, adjustments can be made. Your doctor may be able to switch you to a different medication that has fewer sexual side effects, or they may adjust the dose to strike a better balance between managing your condition and maintaining your quality of life. Sometimes, simple timing changes like when you take the medicine can make a difference. Also, remember that ED caused by medications is often reversible. Once the medication is adjusted or changed, sexual function may gradually return. Your doctor may also recommend ED treatments such as oral medications like Viagra or Cialis, a vacuum erection device, or lifestyle changes to support overall health and blood flow. The most important message is you're not alone, and there are solutions. Many men feel embarrassed to bring up ED, especially when it's related to medications. But a good doctor will listen, understand, and work with you to find the right plan. Your sexual health is part of your overall health, and it deserves attention. Just like your blood pressure, mood, or cholesterol. If you suspect your medication may be affecting your erections, don't stay silent. Ask questions, get support, and know that help is available. Many people think of erectile dysfunction ED as purely a physical problem, but the truth is, your mind plays a powerful role in your ability to have and maintain an erection. For men over 50, psychological stress, anxiety, and even relationship worries can quietly contribute to ED, sometimes more than we realize. Let's start with how an erection works. It's not just about blood flow or hormones, it begins in the brain. When you feel relaxed, safe, and sexually stimulated, your brain sends signals down your spinal cord to the nerves in the penis. This causes the blood vessels to open and fill with blood, leading to an erection. But when you're stressed, anxious, or distracted, that signal from the brain gets interrupted. For example, if you're worrying about work, finances, your health, or your relationship, your brain may be in a fight or flight mode. In this state, your body releases stress hormones like cortisol and adrenaline, which tighten blood vessels and make it harder for an erection to occur. Even if the desire is there, your body may simply not respond. This becomes even more challenging if you've had an episode of ED before. Many men fall into a cycle known as performance anxiety. You might start fearing that you won't be able to perform, and that fear itself creates more tension, making the problem worse. Over time, this stress can chip away at your confidence and reduce your desire to even try. Depression can also play a major role. It affects energy, mood, and motivation, all of which are closely tied to sexual interest. And unfortunately, some antidepressants used to treat depression, as discussed in Key Point 4, can also cause ED, which adds another layer of frustration. So what can be done? First, know that you're not alone, and this is not a weakness. Psychological ED is very common, especially during times of change, retirement, illness, caregiving stress, or grief. Talking openly to a trusted doctor, therapist, or counselor can help uncover the emotional barriers that may be affecting your sexual function. Second, small steps towards stress relief can make a big difference. This might include gentle exercise, regular sleep, mindfulness or breathing techniques, or just spending more quality time with your partner without pressure. Sometimes, rebuilding intimacy slowly with touch, closeness, and communication can help take the pressure off performance. In many cases, combining therapy with medical support like ED medications provides the best results. These treatments can help restore confidence and allow your mind and body to reconnect in a healthier, more relaxed way. Remember, sexual health is about more than just the body. It's about the whole person, your thoughts, feelings, and emotional well-being. If you're over 50 and struggling with ED, don't suffer in silence. You deserve support, compassion, and real solutions, and they are within reach. As men grow older, prostate health becomes an increasingly important part of overall wellness, and it can have a direct effect on sexual function, including erectile dysfunction ED. Many men over 50 experience changes in their prostate that, while common, can sometimes interfere with erections and sexual satisfaction. The prostate is a small gland located just below the bladder. Its job is to help produce fluid in semen, but as men age, the prostate often enlarges, a condition known as benign prostatic hyperplasia (BPH). This isn't cancer, and it's not usually dangerous, but it can cause urinary symptoms like frequent urination, weak stream, or getting up often at night to go to the bathroom. What many men don't realize is that BPH and other prostate conditions can also affect sexual function. First, an enlarged prostate can irritate the surrounding nerves and tissues involved in sexual response. Second, treatments for prostate issues, including certain medications and surgeries, can also cause or worsen ED. For example, medications like alpha blockers, which are commonly prescribed to relax the prostate and bladder muscles, may affect blood pressure and sometimes interfere with ejaculation. And while helpful for urinary symptoms, they may also change the way your body responds to arousal. Some men notice a drop in sexual desire or ability to maintain an erection. Surgical treatments for more severe prostate conditions, including prostate cancer, can also impact sexual health. Procedures like prostatectomy, removal of the prostate, often involve nerves that are closely connected to erection function. Even with nerve-sparing techniques, it's not uncommon to experience temporary or long-term ED after surgery. It's also worth noting that chronic prostatitis or inflammation of the prostate can cause pelvic discomfort, pain during ejaculation, or a feeling of pressure that can make sex uncomfortable or less pleasurable. These symptoms can add to stress, which further contributes to ED. So what can be done? First, if you're experiencing urinary symptoms or changes in sexual function, don't ignore them. Talk to a urologist. A simple exam and a few tests can help identify if your prostate is playing a role. Early diagnosis of prostate problems often leads to more treatment options and better results. Second, not all treatments for prostate conditions lead to ED. There are newer medications and less invasive procedures available that protect sexual function better than older approaches. Your doctor can help tailor the best option for your health, lifestyle, and concerns. Third, if ED is already a problem, there are still solutions. Medications like Viagra or Cialis can help, even after prostate treatments. Other options include vacuum erection devices, pen-il injections, or implants for more persistent cases. You are not out of options. In short, your prostate health matters not just for urination, but for your sexual health and confidence as well. Don't be afraid to ask questions or seek help. With the right care and support, many men over 50 continue to enjoy a healthy, satisfying sex life well into their later years. Remember, you're not powerless, and you're certainly not alone. The first step is understanding, and the next step is action. So if this video helped you or someone you care about, give it a like and share it. You never know who might need it today. And don't forget to subscribe for more trusted, senior-friendly health advice from a urologist who truly cares. Your health matters at every age.